hospital, the Capital Health Surgical Center, is one of the two hospitals that have benefited from the goodwill of the Abdul Samad Rabiu initiative in one day. The other hospital being the Gwarimpa General Hospital, where the pediatric department benefited immensely from this initiative. While handing over the initiative's donations to the two hospitals, which are drawn from the private and public health sectors, Managing Director of the Abdul Samad Rabiu Africa Initiative, Ubun Uda, says over 19 billion naira was expended on the health sector alone in 2021, and the General Hospital Gwarimpa intervention was just a special request granted by the founder of the ASR Africa Initiative. This is as a result of the importance the founder attaches to healthcare delivery for women and children.
So we got an unsolicited proposal from this facility. While we were here, we realized that there are a lot of really indigent patients, that kids that come here, especially the pediatric neonatal, and so we felt it would be good to not just provide the equipment. Of course, we're going to follow up. We're going to monitor use of the equipment. We've signed what we call a mutual accountability framework. That means that both we, ASR Africa, and the Gwarimpa General Hospital are going to be mutually accountable and responsible for following up and maintaining the equipment and seeing that it's properly used. But beyond that, also looking at if the health outcomes are getting better. Are we finding more people getting better? Are the mortality rates going down? We're also going to monitor that. Our health specialist is here. She's going to handle that. And we just also felt that we could contribute a bit more by opening a fund. So what we've done is to open an account. We've put 500,000 naira in it, where the indigent patients that come can draw from that fund.
The ambulances and medical equipment donated for each hospital have already been installed in the respective hospitals. The ASR Africa team was taken on a tour of the pediatric and surgical wards of the Gwarimpa General Hospital. Appreciative words from the officials and staff of the hospital gives hope that the intention of the donations have been met and surpassed.
We all know government cannot do it alone, especially as we are coming out of the pandemic, where a lot of resources that were meant for this kind of things have to be diverted to fight the pandemic. So at this time, when private sector come to support government, the government is always happy and pleased with this kind of gestures.
We have a brand new neonatal unit, I think the latest in FCT, equipped with modern equipment. The workers there are going to have a very nice working environment. I'm sure the babies, the neonates, if they can talk, they will also say it. We have new delivery beds where women in labor will labor with less or little pain. We also have a brand new theater where the surgeons will be operating and they won't have problems.
At the Capital Health Surgical Center, the ASR Africa team was received by the management led by Dr. Ikemba Iwela, who also expressed deep appreciation to ASR Africa for standing in the gap.
We ran into Haji Salah and the Bua company, who happen to have the same type of ideas that we have. And when we talked to them, we didn't have to have any series of meetings or anything. It was like, is that why you want to talk to me? Yes, consider it done. And they're here, and they're here today. And they have donated so many things to us, and they want us to continue in that spirit.
For the Abdul Samad Rabiu Africa Initiative and the parent organization BUA Group, it is not just about donating equipment to hospitals, but keying into the vision of the receiving organizations as strategic partners and the desire to give back to society by the donor.
For us at BUA, ASR Africa, and especially Alhaji Abdul Samad Rabiu, social initiatives and CSR like this are the ways we color the lives of people around us, the ways we color the lives of people in our communities, the ways we color the lives of those who actually pay for our goods and services that we produce at BUA. But most importantly, it's our way of giving back.
With these donations to the health sector by BUA, it is expected that utilization of these equipment will significantly improve healthcare delivery for Nigerians living in these locations. Mbasiti Jesse, Viewer Television.